Okay, so imagine you go to the doctor,
Yeah.
not just for like a regular checkup, right?
Right.
But for a glimpse into your health future.
Wow.
What if they could predict like potential health risks years in advance?
Yeah.
Like all thanks to an AI assistant just crunching through tons of the data, you know?
That's the kind of world we're stepping into today as
Yeah.
we take a deep dive into AI in healthcare.
It's exciting.
It is. It's not science fiction anymore.
Yeah.
AI is already changing how we diagnose, treat, and even prevent diseases.
It's kind of mind-blowing when you think about it.
It is.
We hear about AI in like every field these days.
It's true.
Healthcare, it feels different, right?
It does.
The stakes are so much higher.
Absolutely.
We're talking about people's lives.
People's well-being.
Exactly. Their well-being.
And that's why the potential of AI in healthcare is so exciting.
Right?
But it also demands careful consideration.
Yeah, for sure.
We have to be very thoughtful about how we use it.
Okay, so let's unpack this a bit.
Right.
Where are we seeing AI make the biggest impact right now?
Well, one area is in diagnostics,
Oh, okay.
like in medical imaging.
Mm.
AI algorithms are now being used to analyze X-rays, CT scans, MRIs.
Yeah.
They can often spot these subtle patterns
Oh, wow.
that even the most experienced radiologists might miss.
So it's like having a second set of super sharp eyes
Exactly.
scanning those images.
And because AI can process information so much faster than humans,
Right.
it can help speed up diagnoses, which is crucial
Yeah.
in like time-sensitive situations.
That makes total sense.
Yeah,
Early detection is so important for so many things.
it is. Absolutely.
Are there any like specific examples?
Oh, there are quite a few.
Okay.
In cardiology, for instance,
Uh-huh.
AI is being used to analyze electrocardiograms,
Okay.
ECGs,
Yeah.
to detect irregular heart rhythms.
Wow.
So these algorithms can identify tiny anomalies
Oh, wow.
that might indicate a heart problem. Okay. Even if they're not immediately obvious to, a human cardiologist.
So it's like having a cardiologist on call, 24/7,
Yeah.
just constantly analyzing your heart rhythms.
Yeah, in real time.
That's wild.
It is pretty amazing.
What are other areas of medicine?
Well, AI is proving particularly valuable in oncology,
Uh,
where, early and accurate diagnosis is really critical.
right. Yeah.
AI algorithms can be trained on thousands of images
Okay.
of cancerous and non-cancerous cells.
Mhm.
They learn to distinguish between them with remarkable accuracy.
So it's almost like teaching the AI
It is.
to become an expert at spotting cancer.
Yeah, like a digital oncologist almost.
Wow.
These AI tools are becoming increasingly sophisticated, helping oncologists diagnose cancer earlier, which, of course,
Yeah.
can significantly improve treatment outcomes.
This is all really promising stuff.
It is.
But I know there are also concerns
Right.
about AI being a black box.
The black box problem.
Yeah, where even the experts don't fully understand
Right.
how it's reaching its conclusions.
That's a very valid concern.
Right.
The lack of transparency in some AI models can make it difficult for doctors to really trust the recommendations,
Yeah.
even if they're statistically accurate.
It makes sense.
Yeah,
If you don't understand the reasoning,
right.
you might hesitate to act on it.
Exactly.
Yeah.
That's why there's this growing push for explainable AI in healthcare. Developing models
Okay.
that can provide clear insights into how they're making decisions.
So it's not just about being accurate.
No.
It's also about being transparent.
It is. It's about being understandable.
Right.
We need AI tools that doctors can trust and patients can feel comfortable with.
Right.
And to build that trust, we need transparency.
Okay, so let's talk about another aspect of this that I find really fascinating. Personalized medicine. This idea of tailoring treatments to each individual.
Right.
It seems like something out of like science fiction,
It does sound futuristic, but
Yeah.
AI is making it a reality
Wow.
by analyzing tons of data,
Mm-hmm.
including a patient's genetic makeup,
Right.
lifestyle, medical history.
Okay.
AI can help doctors create these highly personalized treatment plans.
So instead of a one-size-fits-all approach,
Right, exactly.
each patient gets a treatment plan designed for them.
Yeah, that's the idea.
Wow.
AI can help identify which treatments are most likely to be effective for a particular patient,
Okay.
minimizing side effects and
Yeah.
maximizing the chances of success.
That's incredible.
It is.
Are there any areas where this is already making a difference?
Oh, sure.
Okay.
Oncology is a great example.
Oh.
By analyzing a patient's tumor cells, AI can help identify which chemotherapy drugs are most likely to be effective, leading to more targeted and successful treatment.
So AI is not just helping with diagnosis.
No,
it's actually helping select the treatments.
It is.
That's amazing.
It's really revolutionizing how we think about and approach healthcare.
All of this sounds really complex.
Right, it is. A lot of moving parts.
Does this mean AI will eventually replace doctors altogether?
That's a question a lot of people ask.
Right.
While AI is transforming healthcare, it's not about replacing doctors.
Right.
It's more about augmenting their abilities and giving them powerful tools to make better decisions and provide better care.
So more like a partnership.
It is.
Between human expertise and AI.
Exactly.
Yeah.
Doctors bring their knowledge, experience, and empathy,
Right.
while AI provides these data-driven insights and helps automate those, routine tasks.
So it's like each one brings their strengths.
Yeah, it's like a true partnership.
Yeah.
And together, they create this more powerful and effective approach to healthcare.
Right. Speaking of improving outcomes,
Yeah.
I've also heard about AI being used to, like, streamline hospital operations.
Absolutely.
How does that work?
Well, hospitals are these incredibly complex organizations.
Yeah.
They're always facing challenges in managing resources, scheduling appointments, and just optimizing workflows.
Yeah.
AI can help address these challenges by analyzing data, identifying patterns, and making predictions.
So it's like having this digital efficiency expert.
So like having...
working behind the scenes. To keep everything running smoothly.
Exactly.
Yeah, okay.
For example, AI can help predict patient influx.
Wow.
Based on, seasonal trends, local events, even weather patterns.
Oh, that's crazy.
It allows hospitals to be proactive and allocate resources like beds, staff, and equipment.
And that would make a huge difference in wait times, right?
It could, especially in emergency rooms.
That's great.
AI can also help optimize operating room schedules, reduce unnecessary tests and procedures, even prevent hospital readmissions.
Wow. So it's really about making things more efficient.
It is, and cost-effective.
Which I think...
everyone can appreciate.
I think so, yeah.
Right.
It's about making healthcare more accessible, affordable, and ultimately more patient-centered.
I like that.
Yeah.
So this has been a really insightful look into the world of AI and healthcare.
Absolutely.
We've covered a lot of ground.
We have,
just in this first part of our deep dive.
Yeah.
From AI's role in diagnostics and treatment to its potential to streamline hospital operations.
Absolutely. It's a lot.
It's a lot to take in.
Yeah, for sure.
And we've only just scratched the surface.
Oh, wow.
In the next part of our deep dive,
Yeah,
we'll explore even more. Fascinating applications of AI in healthcare.
Oh, cool.
Including its role in drug discovery and the development of personalized medicine.
Okay.
We'll also delve into some of the ethical considerations.
Yeah, for sure.
And challenges that come with this powerful technology.
Yeah, I'm really interested to hear about that.
It's a really important part of the conversation.
It is.
We have to be mindful of the potential downsides as well as the benefits.
Absolutely.
So stay tuned for that.
We'll be back soon with even more insights.
Yes.
And expert analysis.
Absolutely. Welcome back to our deep dive into AI and healthcare.
Thanks for having me back.
We've seen how AI is already transforming how we diagnose and treat diseases.
Right.
But its potential extends far beyond the walls of the hospital.
You mentioned drug discovery last time.
I did.
It's hard to imagine AI playing a role in something as complex as developing new medications.
It might seem like a world apart, but AI is proving incredibly valuable in accelerating the drug discovery process.
Okay.
Traditionally, developing new drugs has been a very long and incredibly expensive endeavor.
Right.
It often takes years and billions of dollars to bring a single drug to market.
It's a process I think most of us probably never think about.
Right. It's behind the scenes.
But it's obviously crucial to advancing healthcare.
Absolutely.
So how is AI changing things?
Well, AI is like a super-powered research assistant capable of analyzing massive data sets of molecular structures, biological pathways, and clinical trial data to identify promising drug candidates.
Wow.
Think of it as like sifting through a giant haystack to find that one tiny needle.
So instead of relying on trial and error, which I imagine is how it's been done in the past,
Yeah, a lot of it has been trial and error.
AI can help pinpoint those candidates much faster.
Exactly. By analyzing vast amounts of data,
Okay.
AI can identify patterns and relationships
Right.
that human researchers might miss.
Oh, wow. Wow.
This lets scientists focus their efforts on the most promising leads, potentially shaving years off that drug development timeline.
That's incredible.
That's pretty amazing.
So it's not just finding new drugs faster,
Right.
but also potentially making it more efficient
Yeah.
and cost-effective.
Absolutely.
The implications are huge.
They are, yeah.
AI could help us develop treatments for diseases that currently have no cure.
Exactly.
And create more personalized therapy.
Oh, personalized therapies.
Oh, that's exciting to think about.
It is. The potential impact is huge.
Now, speaking of personalized medicine,
Yeah.
we talked about it earlier in the context of treatment.
We did.
But you mentioned it could also play a role in preventative healthcare.
Absolutely. AI is opening up new frontiers in personalized health and wellness.
Okay.
Imagine an AI-powered app that analyzes your genetic data, lifestyle habits, environmental factors to provide personalized recommendations for diet, exercise, stress management.
It's like having a virtual health coach.
It is. It's like having...
But one that truly understands your individual needs.
Exactly, and can provide tailored advice to help you stay healthy.
That's amazing.
It is.
It's a shift from reactive healthcare to a more proactive approach.
Exactly, using AI to stay healthy and prevent illness in the first place.
This focus on preventative care.
Yeah.
That could have a huge impact on our health.
It could. A huge impact.
And well-being.
Absolutely.
But with all this talk about AI analyzing our personal data, it raises some concerns about privacy and security.
Right. That's a valid concern.
How do we ensure that our sensitive health information is protected?
That's a critical question.
Yeah.
As AI becomes more integrated into healthcare, protecting patient privacy is paramount.
Right.
Robust security measures are essential, along with clear regulations on how data can be used and shared.
So it's not just about the technology.
It's not, no.
Yeah. It's also about safeguards and guidelines.
Exactly, to ensure that patient data is used responsibly and ethically.
Transparency is also crucial.
Absolutely.
Patients need to understand how their data is being used.
They do.
And have control over who has access to it.
Right. It's about building trust.
It is, yeah.
People need to feel confident that their information is being handled securely and that their privacy is being respected.
Without that trust,
the
full potential of AI in healthcare can't be realized.
Exactly. Trust is essential.
Now, we've talked about all the ways AI can improve healthcare.
We have.
But what about the impact on the healthcare workforce?
Yeah.
There's a lot of talk about AI potentially automating jobs.
Right.
How do you see AI changing the roles of doctors, nurses, and other healthcare professionals?
It's understandable that people have concerns about job displacement.
Yeah.
But I see AI as an opportunity to enhance and evolve the healthcare workforce, not replace it.
So instead of taking over jobs, AI is changing the nature of those jobs.
Exactly. AI can handle repetitive tasks, freeing up healthcare professionals to focus on what they do best, which is providing compassionate, personalized care.
Right. So it's taking care of the data crunching.
It is. It's like...
So doctors can spend more time with their patients.
Yeah, exactly.
That sounds like a win-win.
It does, yeah.
Patients get more personalized attention from their doctors.
Right.
And doctors get to focus on the parts of their job they find most rewarding.
It's about creating a more collaborative and efficient healthcare ecosystem where human expertise and artificial intelligence work together to deliver better care.
Now, we're focusing on the positive aspects.
Of course.
But it's important to acknowledge that there are potential challenges.
Absolutely, there are.
And concerns.
We have to be realistic about that.
Yeah. What are some of the hurdles we need to overcome?
Well, one of the biggest is ensuring that AI systems are fair and unbiased. AI algorithms are trained on data.
Right.
And if that data reflects existing biases, the AI can perpetuate those biases, leading to disparities in healthcare.
So it's not just the technology itself.
It's not. It's the data that's used to train it.
The data is flawed.
Yeah.
The AI will be flawed too.
Exactly. So we need to ensure that AI systems are trained on diverse and representative data sets to minimize bias and promote equitable healthcare for everyone.
That makes sense. What about regulation?
That's another major challenge. Healthcare is a highly regulated industry.
Right, and for good reason.
And for good reason, absolutely.
How do we ensure AI meets those standards?
Well, the rapid pace of AI development is outpacing the development of clear regulatory frameworks.
Oh, wow.
We need robust guidelines to govern the use of AI in healthcare, ensuring patient safety, data privacy, and accountability.
It's a bit like building a house without a blueprint.
Yeah, it's like
you need a framework.
You need that solid framework to guide the process and ensure everything is done correctly and safely.
And this requires collaboration.
It does.
Between policymakers, healthcare providers, technology companies, and ethicists.
Yeah, absolutely.
That's a lot of people.
It is. It's a complex undertaking.
Yeah.
But it's essential for the responsible development of AI in healthcare.
Now, before we wrap up this part,
Yep.
I want to touch on something we mentioned earlier. The human element.
The human element, that's key.
With all this talk about AI and technology,
it's
easy to forget that healthcare is ultimately about people caring for people.
It is at its core.
How do we ensure the human connection remains at the heart of healthcare?
That's a crucial point. AI should never replace the human touch in healthcare.
Okay.
It should be used to enhance and empower healthcare professionals to provide even better care.
So it's about finding the right balance.
It is. It's about finding
between technology and human interaction.
The right balance. AI can handle data analysis, automate routine tasks, provide valuable insights. But it's the human healthcare providers who bring empathy, compassion, and the ability to connect with patients on a personal level.
It's a good reminder that technology should serve humanity.
Absolutely.
Not the other way around.
Technology should serve us, not the other way around.
As we continue to explore AI in healthcare, we need to keep this human-centered approach in mind.
I agree that human-centered approach is crucial.
Welcome back to the final part of our deep dive into AI in healthcare. It's been an incredible journey exploring how AI is transforming everything from, diagnosis and treatment to drug discovery and preventative care.
We've covered a lot, but there's still so much to discuss in this final part. I think it's important to consider the broader societal implications of AI in healthcare, beyond just the individual patient.
That's a great point. We've talked about the impact on patients and healthcare providers, but AI in healthcare also raises important questions about, equity and access and the future of our healthcare systems.
Exactly. One of the biggest questions is, how do we ensure that the benefits of AI in healthcare are accessible to everyone, regardless of, their income or where they live or other factors?
It's crucial. We don't want AI to exacerbate existing healthcare disparities. We want it to help bridge those gaps and create a more equitable system for all.
Absolutely. We need to be really mindful of potential biases in AI systems and address them proactively. We also need to make sure that AI-powered healthcare solutions are designed and implemented in a way that is accessible and affordable for everyone.
It's about making sure AI is a force for good in healthcare, promoting equity and improving access for all. Now, speaking of access, one of the things that struck me during our conversations is the potential for AI to democratize healthcare, particularly in areas with limited access to specialized medical care.
Yeah, that's a really exciting prospect. Imagine AI-powered diagnostic tools that can be used in remote villages or underserved communities, providing access to medical expertise that was previously unavailable.
It's like bringing the power of a specialist to even the most remote corners of the world.
Exactly. And this could have a profound impact on global health, improving healthcare outcomes for millions of people.
It really highlights the potential for AI to make a real difference now. Before we wrap up, I want to touch on another important aspect of AI in healthcare, and that's the role of public engagement in education.
Oh, that's crucial for AI to truly thrive in healthcare. We need to build public trust and understanding. People need to feel comfortable with AI being used in their healthcare and confident that it's being used responsibly and ethically.
It's about demystifying AI and empowering people to make informed decisions about their healthcare.
Exactly. We need to have these open and honest conversations about the potential benefits and risks of AI in healthcare. Address people's concerns and educate them about how AI works, how it's being used, and what safeguards are in place.
It's about fostering a culture of transparency and collaboration, where patients, healthcare providers, policymakers, and technology companies all work together.
Absolutely. And ultimately, it's about using this powerful technology to create a healthier and more equitable future for all.
Wow, what an incredible journey this has been. We've explored so many facets of AI in healthcare, from the technical aspects to the ethical considerations and the potential impact on our society as a whole.
It has been a fascinating conversation, and I hope it sparked some curiosity about the role AI will play in your own health journey.
If you enjoyed this deep dive into the world of AI in healthcare, be sure to like and subscribe for more explorations into fascinating topics. We'll keep bringing you the knowledge you need to navigate an ever-changing world. Thanks for joining us.